adapting your continuity plan to the pandemic. Today we'll be discussing the business continuity standards that should be considered across each of the Centers for Disease and Control and Prevention's pandemic intervals. Organizations can better prepare themselves to sustain operations by taking key response actions as the disease progresses. I realize depending on where you are located, your organization could be in different phases of the pandemic. However, we'll spend the majority of our time in the acceleration interval based on current conditions. Our featured speaker is Sarah Vanderkapellen. Sarah has 20 years experience in the nexus between business continuity, public health preparedness, and emergency management. Sarah recently led the restructuring of Tetra Tech's business continuity program and is actively providing executive-level epidemiological consulting and business consulting to Fortune 500 companies. She's earned a master's degree from Yale in public health and is a certified master business continuity professional by the Disaster Recovery Institute International. As you heard, we are going to be recording this webinar for future sharing purposes. We've also muted all lines, but if you have a question during Sarah's presentation, click on the message icon and post that question, and I'll be answering those questions along with Sarah during our question and answer session. With that, I'd like to turn the call over to Sarah.
Great, thank you, Jeremy, and thank you for joining us today. So what do we mean when we say where science and business continuity intersect, adapting your continuity plan to the pandemic? This really means that organizations are at a spot right now where we can leverage the science and the planning for pandemics to strategically plan forward for the next phase. So we're going to talk about how we can do this on today's webinar. On your screen, you should see a graphic that aligns continuity planning concepts with the CDC's pandemic intervals. So the inner circle of this graphic really represents your continuity program. So if you're in the private sector, those 10 outer circles are going to look familiar to you. These are DRI International's professional practice areas. So these are the standards to which many organizations build and or maintain their continuity programs. But if you're involved in continuity in the public sector, you're going to be more familiar with incorporating FEMA's 10 elements of a viable continuity capability into your program. For example, your essential elements, your orders of succession, your delegations of authority, your continuity facilities, and so on. But irregardless of being either in the private sector or the public sector, your continuity program really incorporates common themes, just different terminology. So generally, your programs are going to be built to support the continuity of your essential functions or essential services is what we hear a lot now, your critical processes, and then the supporting pillars that allow you to perform those services, including your leadership, your staff, your facilities, and your equipment. So the outer circle illustrates CDC's pandemic intervals, and we've lined up the intervals to demonstrate where continuity actions fall into the timeline of the pandemic. And so we'll address each of these intervals in more detail in the next slides. So as you know, from the current COVID-19 pandemic, there are generally two guiding authorities that are followed to widespread and related to widespread outbreaks, such as Ebola outbreak and the current pandemic. So these are the CDC pandemic intervals and the WHO or the WHO pandemic intervals. So these systems do align. However, within the United States, our leading health authority is the CDC, and then our state and local health departments really receive their guidance and support directly from the CDC. So before we take a look at where we are currently, let's take a quick look back to see how we got where we are and how we quickly found our lives, how we quickly progressed through the first 3 pandemic intervals to find ourselves in acceleration interval. So, similar to other disasters and emergencies, watching a pandemic unfold can be similar to watching a hurricane come out of the Atlantic or even a wildfire take foothold and start burning through a mountain range. The virus and also its ability to treat the virus and our ability to treat the disease determines how fast it will impact a country and also the world. And so we know that cases started in December and we're already 3 pandemic intervals in. Now within the US, we're currently experiencing acceleration. So in investigation, this goes back to about December when we started hearing reports of a novel or strange pneumonia clusters in China with speculation about what the disease could be. It could be maybe it's a novel influenza, maybe it's coronavirus. But at this point, travel and industry really continued to operate as normal. Okay, and then we went into recognition. And this is where we determined that it was a zoonotic disease, meaning that it had jumped the species barrier from an animal and into humans and was quickly spreading human to human. We saw a large spike in cases in Wuhan, and then that really grabbed the global health authorities' attention. We started to see quarantine stations established here in the United States. Travelers from affected areas started to import cases into the U.S. We saw Wuhan shut down on January 23rd for 76 days. And really within that week, US-based airlines became increasingly concerned about travel to and from the affected areas. And we saw an increasing number of human cases and clusters of disease domestically. And at this point, we probably started wondering how the spread of this new disease was going to affect our operations in our lives, and hopefully started to think about our continuity strategies. And then we transition into the initiation interval. And this is the beginning of the epi curve, the infamous epi curve of that curve trending upward. And that's the curve that we're currently trying to flatten now. So this is where you may have considered or actually activated your continuity plans. So state and local governments began issuing stay-at-home orders, schools started closing, we started seeing essential business designations, we started implementing a lot of those non-pharmaceutical interventions within the US, and these are the isolation of the sick, quarantine of exposed but asymptomatic people, hygiene protocols, and social distancing measures. So we started really implementing a lot of those non-pharmaceutical interventions within the US. I think right now, at this point in the situation, in initiation, what's interesting to me from a continuity perspective is how quickly we saw some businesses were able to identify how they were going to be affected and left behind potentially if they didn't quickly adapt and make adjustments to stay open. Think about how many, for example, think about how many restaurants in your area changed their operations so that they could both stay open and provide needed goods and services. So did you ever think that the pizza restaurant could so quickly transform from pizza into contactless mini grocery store? And this is really community resilience and business continuity at the very boots meet the ground level. So the ability to recognize where we were headed and then realign with what we needed to do. So I'm including this here because I think it's important for a couple reasons. One, first is to encourage you to reflect at this point on the level of awareness within your organization. Specifically, this early in an emerging infectious disease outbreak, what triggers prompted early awareness in your organization? Were there any? And can you parking lot any of those ideas that you had? Because we might continue to see this come up again and again. If it's not coronavirus, it could be something else. And also to remind you that pandemic planning really provides a structure for organizations to plan strategically for that next interval. Okay. So as we move into acceleration, we've seen a dramatic increase in the number of new cases, both within the US and globally. We've seen a sharp increase in the number of hospitalizations and unfortunately morbidity or deaths related to this disease. We have and we continue to see concerns about the disease outpacing our medical system's ability to manage these cases, and also public health's ability to test and track new cases. And we heard that the WHO declared a pandemic on March 11th, and then the CDC quickly fell into lockstep with the WHO. So at this point, there are a lot of continuity strategies that you can be implementing. The first is really to be proactive in your internal communications. So if you're if I've ever worked with you on a continuity program, you will remember that I really hone in on this one and your internal communications, notifications and communications, because this is really where you meet your employees. And that's, we were all aware that something was going on overseas and that it was coming to the US. Did we reach out, and did you reach out to the people within your network and within your team to say, we are aware of this situation, this is what we're doing to monitor it, and are you and your family okay? Because if we don't have our workforce, then we can't continue operations. Also, reach out to your clients and your external stakeholders. As we've seen throughout this pandemic, that our needs have changed, and they can change on a daily and a weekly basis. So establishing your, reaching out to your stakeholders, your clients to say, are you okay? Do you need anything? Or I need this, or I don't need that anymore, I need something else. That's really important because our needs are quickly changing. So stay in touch. So at this point, we also have the ability to utilize resources to facilitate science-based decisions. So while pandemic planning is currently centered around, this COVID-19, it can also be centered around a novel influenza or the flu. The planning guidance rings really ring true for any widespread novel illness like we're experiencing right now. So you can incorporate public health expertise into your organization. So this is done in a few ways. So you can identify that public health expertise can help you identify which data will best help you make science-informed decisions for your organization, where to find these data pieces, when they're updated, and how to analyze them. So this is where you can look at the information, all the numbers coming out, whether or not they're analyzed, the rates, the number of cases, the attack rate, the morbidity, case fatality rates, and help your organization to make better science-based decisions. And then what we really want to do here is help your leadership and your staff become more informed consumers of the public health message. As we've seen over the last few months, that we need to remain flexible and realign our strategies. So this is something that is changing every day, and we, as I mentioned earlier with the restaurant example, they really realized quickly how they can realign their service line so that they can stay stay in business. And so that's something that we want to make sure that we encourage you to do also. And then we've progressed through a lot of different stages in this. And so we encourage you to remember that we didn't get here through just one step. We walked through a lot of steps, and as we walk through steps, if you can document the steps that you walked through, then when we step this down, we might be walking through very similar steps. Okay, in this, we want to make sure that we're looking forward to recovery, right? And so many of you have documented recovery plans for your organization. Information technology, systems infrastructure, and we're talking about your organizational recovery. So returning to work, returning business to normal, your service lines and your production back to normal. So as your organization continues to respond to this pandemic, this also triggers an opportunity to be forward planning in your organization's recovery. So what does this really mean? We've seen an unprecedented response in this country with social distancing, with businesses completely restructuring their methods of service delivery, restaurants, example, the curbside takeout, the leveraging mobile apps to address enormous economic impact of this pandemic. There have been and there'll continue to be multiple recovery opportunities. So I think it's really important to start identifying your recovery efforts now, and this includes forward thinking again. So what steps does your agency specifically need to do to return people to work? Look at your staffing levels, your disinfection and your cleaning of workspaces, your ongoing protocols, your procedures to provide safe and healthy workspaces, your organizational impact and cost recovery. There are available opportunities, funding opportunities, and how can you leverage these to help your organization? And if your organization, for example, is part of a local or state infrastructure, where do you fit into their recovery picture? And so really at this point, document the activities and the observations that you have, the steps that you've already walked through, so that when you go back and we start to recover, you can go back and look at your notes. Another very simple step that you can be doing right now is in either developing or updating your plans and procedures. For example, if you have your agency's plans and procedures, you can go in, you can open it, save it with a new name, and start making updates. Use track changes, and so then you know that when you have a few more minutes, you can go back and make the updates that your agency needs. Or if you're an agency, maybe you don't have plans and procedures, this might be an opportunity. There's a lot of information that we're seeing now, planning coming out, that this might be a great opportunity for your agency to actually develop some plans and procedures so that the next time we go through this, you are in a different position and you've learned from where we just have come through, what we've come through, okay? This is what everyone wants to know. When can we go back to work? And so in deceleration, we're going to see that propagated epi curve, right, showing decreasing rates of new cases in the US and other parts of the world. So the demand at this point on the healthcare system should be matched by the capabilities within that system. And so in returning to work and thinking about how we're going to go back to work, there are a lot of different strategies that we can implement, and a lot of policies that we can be looking at now and plans that we can be looking at and developing now. The first one is social distancing. So there are a few different ways that we can implement social distancing into going back to work. The first one is looking at alternate work schedules. For example, if you have 10 cubes in a row, you can say the alternates come in on Monday, Wednesday, Friday, and then the even ones come in on Tuesday and Thursday, and that gives space, the social distancing or the physical distancing between people, and also it gives you time to disinfect the workspaces. Another option that you can implement is to look at different workstations. So you can have people in different buildings or on different floors and look at different workstation plans. Another thing that we want to do within return to work is make sure that you're, let's step back just a moment. And also looking at social distancing and returning people to work. Another thing to do is consider your workforce. So there are going to be people who are really eager to come back to the office. Okay, and so, but then you're also going to have another subset of people who might not be so eager to come in because of what they're concerned about exposures that they might be bringing home. For example, if someone is caring for an immunocompromised loved one, they might not be the first person that's going to volunteer and want to come back to work. So that's another strategy that you can really look at as you return people to work. Okay. Another thing is when we look at hygiene, you have to make sure that you've enhanced your cleaning procedures. Do you have sufficient supplies for your employees and visitors on site? Another thing that you can do in here is to do screening when people come in to your facility. Ask them, do you have a fever? Do you have a cough? Do you have shortness of breath? And then ask them that again on the way out. And you're track where in the facility that they're going, so that if they become ill, then you have a log of where exactly within a facility they went. And so that will help any contact tracing if they were to get sick on Also, look at quarantine, some options for quarantine. So these are people who've been exposed but are not yet symptomatic. So can, review your telework policies. Maybe they're not sick, so they can continue to work. So do they still have the resources at home to work remotely? Another option with quarantine is to take, as those people come out of quarantine, to put them in an alternate work station where that's reserved for people coming out of quarantine. So they're set aside from people who haven't been in quarantine. And then also look at your isolation. Isolation is for exposed and symptomatic, ensuring, if you're on the HR side and healthcare side, making sure that your healthcare plans have allowances for your employees. And also with this one is making sure that you have lines of succession, delegations of authority identified, and alternate staff. So when people do get sick while they're out, you can ensure that you have your leadership in place to make those decisions, and alternate staff. Okay. As I said earlier, recovery really starts within that acceleration interval. However, your recovery should be in full swing during preparation, and as we come out of deceleration and then move into the next interval of preparation, you should be in full swing of recovery. So this phase should be your plan for the organizations for new normal, right? Because we're not going back, we're not flipping a light switch and everything is going to be normal. Again, this is going to be a new normal, and you're going to have forward planning for possible resurgence of this disease. And this is a common aspect of diseases, to see a spike or an increase when society reduces mitigation measures, right? And so that's what we're trying to prevent right now. So in this interval, it's really your time to conduct an after action process, evaluate how your organization responded, and to codify what worked well, codify that into your plans, your protocols and procedures, and then address what didn't work so well, and you can identify the improvements. And so this is also your interval for implementing your steps for financial recovery. So if you look on the screen, you're going to see a lot of different things that you can include. If you're not familiar with writing an after action report, you can just start with very basic buckets. For example, you can do communications, what worked well, what didn't work so well. Your essential services, did they match your plan? If not, maybe update your plan. Look at your workforce and talk to your people. Did you pull what were classified as non-essential personnel? Did you pull them in and they started becoming essential for your organization? Look at your equipment and your IT access. How did that work? Did people have the access that they needed, equipment and IT access, to actually perform their essential services? And then as you go through the after action reporting process, conduct debriefs with people, reach out within your organization, what worked well, what didn't, because again, if this is the first wave that we're seeing, we should be prepared for the next wave. And also, if it's not this, it could be pandemic influenza. So update your plans and procedures, and then go back, conduct training on the updates that you made, and any exercise your plan. Okay. With that, I'm going to open it up to any questions. Some of these questions, what I might do is, I'm going to go back to this, the screen. So if you can still see my screen, I want to make sure that we answer your questions and that I'm not kind of glossing over this too much. What we'll do is, you should have my contact information in here. And so please feel free to reach out to me. My email is in the presentation, as is my cell phone. That's my personal cell phone. So feel free to reach out and ask your questions. Send me an email and we can get on the phone and I can really understand the specifics of each of your question. Okay. Because I see we have some about HIPAA considerations. We have some about small business administration, etc. Okay.
I was going to say, in the interest of time, Sarah, I like your approach for getting back to folks. Several of the questions I think also lead right into our next presentation. I'd like to invite everybody on the call to please join us on May 6th at 1:30 Eastern, where we'll host another webinar, which is on COVID-19 disinfection guidelines, dispelling rumors and distinguishing facts from fiction. This should be a timely discussion as movement restrictions are starting to ease nationwide. With that, I want to thank everybody for their time today, and we look forward to continuing the discussion with you. Thank you.